Hi, you're most welcome to this short presentation that will tell you a little bit more about the TU Dublin programme TU155 Graduate Entry Clinical Measurement Science. This programme is offered by the School of Physics, Clinical and Optometric Sciences and is located on the Grange Gorman campus in the city centre. In this short presentation, we'll look at the programme, entry requirements and the possible career opportunities following that programme. What is clinical measurement science? To some, it's a hidden profession. It's a profession that's based in our hospital systems. Every hospital throughout the country has a team of clinical measurement scientists, or sometimes called clinical measurement physiologists. It's a health and social care profession discipline, of which there are about 26 disciplines, and this is just one of them. It is a clinically based profession. It is entirely hospital based and it is looking at diagnostic techniques for patients in hospital settings. It's a highly technical career and it's very patient focused. So our graduates are working with patients in a hospital setting on a daily basis, either in outpatient clinics or on the wards within the hospital system. Clinical measurement science has a number of sub-disciplines. The four that are offered in TU Dublin are respiratory physiology, cardiac physiology, neurophysiology. There is one other, gastrointestinal physiology, and that is not offered at TU Dublin. For this particular graduate entry programme, we focus on two of these, respiratory physiology and cardiac physiology. And the reason we focus in particular on these two is because this is the biggest need for graduates in the country at this time. Vascular physiology and neurophysiology are highly sought after graduates too, but there are less placements available, and we'll see a little bit later when we look at the programme structure that placement is really important. So because placements are a little bit less available in those disciplines, for now we're focusing on respiratory physiology and cardiac physiology. Every graduate of this programme, and indeed the equivalent undergraduate programme, is employed. There is a huge demand for qualified clinical measurement scientists or clinical measurement physiologists throughout Ireland and indeed across the world. So there are vacancies in HSE hospitals nationwide, in the private hospital network in Ireland, and there is also opportunities internationally. And some of our graduates from across the years have travelled to Australia and similar places and are practising within their profession. So to look a little bit more at cardiac physiology, what do we mean when we talk about diagnostics in cardiac physiology? Well, we're talking about everything from ECG to stress testing to echocardiography to Holter monitoring, to monitoring people and their heart condition via loop recorders, for example, on a daily basis from their home, to working alongside the clinicians in cath labs for people who are having stents placed, and many other diagnostic techniques in the cardiac physiology space. When we're talking about respiratory physiology, we're talking about the whole range of lung function tests, whether it's gas exchange, spirometry, to name but two. So the physiologists in this particular discipline work with people who have diseases, for example, like asthma, like COPD, like cystic fibrosis, and many other lung conditions. To talk a little bit about the programme, first of all, our entry requirements. So this is a graduate entry programme, and that means that all of our students of this programme already have an honours degree, usually a 4-year honours degree in the science area. It must be at level 8 on the National Framework of Qualification, and it must be in an area related. So any science programme that includes physics, chemistry, biology and maths at an introductory level, and for that you can interpret that as meaning at first year level, biology at first year and anatomy and physiology at least at second year, and at third year would be desirable as well. So any honours degree programme in science that meets those criteria and that you've achieved a 2-2 or better are eligible to apply. I do have to say that places on the programme are limited, and because places are limited, competition is strong. So we encourage all of our applicants to make a very full application, to provide their transcripts, to provide any experience that they have, because without this it's difficult to make a full assessment for each applicant and to decide on allocating the places. To look a little bit at the programme outline. So it's a 2-year programme attracting 120 ECTS credits. In year 1, we are on campus undertaking lectures and lab sessions up to about mid-December. And just to confirm that 2 days a week in that semester is on campus and 3 days are online. It's important to remember that this is a full-time programme and does require your full-time attention. So to look at some of the modules that we undertake. We do an introduction to clinical measurement sciences and disease pathology. Why do we do disease pathology? If you think about it, all of the patients you'll be interacting with in the hospital system, they are all ill. They all have some sort of a pathology or some sort of a condition that requires them to undergo diagnostic tests, either to determine a particular diagnosis, to look at the progress of disease, or indeed to monitor how they're getting on as a function of particular treatments that they're undertaking. We also do a medical instrumentation and imaging module, and this is a really important module because if you think about it, clinical measurement scientists use very sophisticated diagnostic equipment and they connect their patients to that equipment and they extract the results from the equipment, and then it's their job to interpret those and to report on those to the clinical team looking after the patient. Therefore, it's really important that they understand not just the disease, not just the patient, their anatomy, their physiology, but also the instrumentation. And that's to ensure that they can get the best results and the most accurate results for the patient with whom they're working. We also do pharmacology, and pharmacology is really important because if you think about it, a patient, for example, suffering from asthma may be taking Ventolin or other drugs. A patient who is being looked after in a cardiac physiology lab could be on statins or other medications. So it's important that the clinical measurement professional understands the interaction of those medications and how they're going to influence the diagnostic tests that they're undertaking. So those 3 modules are undertaken from September through to early December, and then we have the first of 3 placements in first year. So placement, you will have a placement in respiratory physiology, you will have a placement in cardiac physiology, and then after your exams in May, you have a 3rd placement for 6 weeks in whichever one of those we determine is your major clinical subject. So some students will be assigned a major clinical subject of respiratory, some will be assigned a major clinical subject of cardiac. How do we decide that? We decide that principally based on the placement opportunities that we have available, on the number of graduates that our hospital system needs, and also on the interest of the student themselves. But we do have to emphasise that it is important that you understand that that is our decision based on all of those factors. So placement takes place in a hospital setting from mid-December to the end of June, with a short break for exams in May. Hospital locations are located right across Ireland. While you're on hospital placement, it is full-time. You are required there 5 days a week. And it's also important to remember that we have a practice education lead staff member and they determine where each student is going. It isn't possible for students to determine their own placement location because we have a significant number of students to place with a significant number of placements to achieve, upwards of 200 in each academic year, and therefore it is important that the practice education lead undertakes that placement. Like most HSCP professions, placement is unpaid and can take place anywhere in the country. So you have 2 8-week placements, followed by exams, followed by a 6-week placement, which brings you to the end of June. So if we look at year 2, again, semester 1 is entirely based on campus with 2 days on campus, 3 days online. You will be told in all cases which 2 days you're required on campus at the beginning of the academic year. So in final year, the subjects we take in semester 1 include advanced medical instrumentation. There are 2 modules there, and they follow on from the first year module in instrumentation and imaging. We also have an advanced pharmacology module. You will also undertake the research methods and methodologies to set you up for your final year project. You then undertake exams in January and head on hospital placement for the entirety of semester 2. And that hospital placement is in your major clinical subject. For some it will be respiratory, for some it will be cardiac. During that time, you're again interacting with patients, you're continuing to gain more skills in terms of your diagnostic skills, and you're also undertaking your capstone project or your final project that is linked to your final discipline. So that explains the programme. It tells you a little bit about the graduate opportunities, which are significant and many. Students, graduates of the programme, will enter into as a basic grade physiologist in the hospital system. Following that, there are opportunities to move right up as far as Chief 2, where you would be managing a clinical measurement physiology hospital-based lab. So there are many opportunities for progression. There's many opportunities for continued professional development. To reiterate, it is a clinical discipline. It is patient-centred. You're working with patients all of the time. So your own personal skills and your professionalism and your ability to interact in a professional and clinical environment with patients, some of whom can be quite worried or vulnerable as they come in to you. So all of those skills are important to the programme. It is an extremely popular programme. The students we have are really engaged in the programme, and it is an absolute pleasure to work with them and see them launch into their career. So we hope you will give some consideration to this programme, and we look forward to meeting with you if you choose to apply. Thank you.